Thanks everyone for joining us today for our webinar, exploring how we can help people who are living with MS. Your presenter today is Bridie Phillips, one of our nurse advisors, and I'm Andrea Salmon. I'll be facilitating today's webinar. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet, no matter where we're dialing in from. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. It is my pleasure to introduce you to Bridie, and Bridie will turn on her camera so you can see her as well. Bridie is a registered nurse, and she's committed the last 12 years plus to community health, predominantly in palliative care, pain management, and within the MS community. Bridie currently works in the MS Nurse Advisor program alongside Jane as our two MS Nurse Advisors. And the Nurse Advisors are available for phone consultations about anything concerning you or in regard to multiple sclerosis. Thanks, Bridie.
No worries. Hello, everyone, and welcome to my home office. Hope we don't get too many disruptions, but this is COVID life, isn't it? So thanks, Andrea, for that introduction. And I'm actually really happy to be presenting this important topic today. Yeah, something a little bit close to my heart, and really I feel privileged to be able to do that. So the aim of today's talk is to further explore the role of family and friends. So you've been through the experience of investigation, diagnosis and initial treatment for a family member with MS. So then what happens further on? So as a family member or friend or someone living with MS, you might be questioning how to continue to care and provide the support for the person with MS. So this webinar has been developed with input from family members and from people living with MS to give you some tips and tricks for providing that care and support in a respectful, nurturing and helpful way. Now, this webinar may spark some thoughts or questions, and if you would like to have some one-on-one time to discuss this, please call MS Connect and schedule in a call with either myself or my colleague Jane online. And note that this webinar talks about some of the difficulties that may be encountered along the way, but as we know, MS relationships are so different for everybody, as is the disease. To begin, this is what we're kind of going to have a look at. We're going to look at a bit about the disease and the symptoms, the experience of living with MS. We'll look at some of the red flags, resources and supports, and what your role is actually in all of this. So to begin, we'll give a brief recap on what is MS and some of those symptoms. So what is MS? So it's actually, the definition, I guess, is that it's one of the most commonly acquired chronic demyelinating autoimmune diseases of the brain, the central nervous system, and the optic nerve. So the myelin, which is the fatty material that insulates the nerves, is damaged, and that results in a disruption of the nerve's ability to conduct electrical impulses to and from the brain. So symptoms can manifest from where the plaques or the lesions appear. These are, they're the actual hardened scars where the myelin is actually lost. So the word multiple meaning many scars, and sclerosis meaning hardening of the tissue. In fact, MS affects over 25,600 Australians, with more than 2 million people diagnosed worldwide. And most people are diagnosed between the ages of 20 and 40, but it can affect younger and older, and roughly 3 times as many women to men. Now, I expect a lot of you will probably know that, but for family and friends of someone with MS, I was hoping just to give a little bit of background to what MS actually is. So the symptoms of MS, so there can be many symptoms of MS, but not everybody necessarily experiences them all or to the same degree. So no 2 cases of MS are the same, and many symptoms can interact with each other. So if we look at this little chart here, we can see the different types of symptoms that MS can cause. The ones that are in italic are not easily noticed. So we call those invisible symptoms. And so you can read there the types of symptoms that there are, and you may have noticed those with some people. So the symptoms can vary and be very unpredictable on any given day, and in fact can require constant adaptation, transitioning, and adjustments. They can react with any co-occurring conditions and can cause a compounding effect. And many of the symptoms are invisible, as mentioned there. So you might notice that the person that you care about might have a limp or balance issues or tremors, but it's not as easy or possible to see that they might actually be experiencing some of these invisible symptoms, of which some are the most debilitating symptoms, for example, fatigue. And it can be really, really variable. So we'll go through a little bit as this presentation goes on. So the impacts on life. So we've just started exploring the symptoms and the impacts that these can have, and they can be quite devastating for some people, and others are hardly noticed. So mild balance problems can be easily managed for someone with an office job, for example, but for someone working on scaffolding, for example, it's disastrous. Or mild changes to thinking and memory might not be a problem for most of us, but if you work with numbers and fast calculations, this is going to be hugely impactful. A question for you. What have you noticed about the person that you care for? If you'd like to put some comments in, we'd love to see some of these comments, and we'll give you a couple of minutes to add any of your comments on the chat line. So you might, you know, whether you have actually sort of wondered whether somebody has an invisible symptom, or is it that you can see the things that are a lot more noticeable?
So we'd love you to pop that in the question area where you can communicate with me. It's Andrea again. So opening up your control panel on the right-hand side of your screen, or using the question mark icon if you're on a tablet type device, finding that question heading and using the little white triangle to open up that dialog box, and type in, tell us what you've noticed. What has been the impact of MS for the person living with MS that's in your life? We'd love to hear your comments. Anyone willing to share with us today? Oh, Bridie, we're not being inundated with comments.
That's okay. We can move on, but just keep that in your mind. What was that?
Yep. Scott's noticed constant tiredness and mental fatigue, and a difficulty finding positives. Okay. That's a real challenging one.
Yeah, absolutely. And it's really insightful that you've been able to actually pick that up, which is really, really great. So we'll go through some of this. So is there any other comments there, Andrea, or shall I move on? And you can have a think about this as we're going through, because I'm sure the next section, as we talk into it a little bit more, is probably going to raise some thoughts for some people.
Gary's made the comment too that as a friend and colleague, it's hard to detect those invisible symptoms because they can be really well concealed particularly in a work situation. Exactly right, Gary.
Absolutely. And probably also, you know, sometimes our people with MS are very good at covering some of these symptoms as well, even though that they might be inwardly feeling them. So let's have a look at this next slide about the experience of living with MS, and this might give you a little bit more insight into what we're actually talking about here. So I've broken this down into several categories. So we've looked at some of the common symptoms an individual may experience and how it may impact their life. So now let's have a look at the personalised experience someone with MS may have. So let's look at internal and external perceptions and judgments. And what I mean by that, internally, someone might have these sort of thoughts, and just have a think about this for a minute. Let's put ourselves into their shoes for a sec. I look lazy if I don't push myself to wash those dishes at the end of the day. Maybe that's the invisible symptom of fatigue. I'm giving in if I use that walking aid. I'm a burden on the people who care for me. I'm not attractive to my partner anymore. They are embarrassed by me. Some of the thoughts that some people with MS might actually be thinking. And externally, so people from the outside looking in, they see someone walking down the street and they've got that Thunderbird stagger, as some people have a bit of a laugh about. But some people think, is that person drunk? Or, I'm tired too. Why can't they? They can't remember anyway, so why bother include them in the conversation? They're angry with me. It might not be personal, but due to the fatigue, again, the invisible symptom. Or a judgment. Why are you eating that chocolate? Shouldn't you be on a special diet? You've got MS after all. So it can be really different for everyone. So we know every person has a different experience, different lesion load, different symptom load. You cannot compare one person to another. Everyone has different metabolism, immune systems, support networks, and other comorbidities. And then we talk about fluctuations. So yesterday you were at the gym and today you can't get out of bed. What? You were fine this morning and you were keen to go to that party. What's happened? MS symptoms fluctuate frequently and they can be same day changes. The individual feels sad, a burden, a disappointment, and don't have the energy or cognitive clarity to explain a change in the level of fatigue, for example. There's also no predictability in your symptoms and how you're feeling. And you're also dealing with a lack of spontaneity. And then we talk about the invisible symptoms and impact. So it's very easy for someone to be dismissive of symptoms that cannot be seen. And as we saw earlier, there are many of these symptoms in MS. So for a person with MS, these are very real symptoms, and often the symptoms interplay with each other. For example, poor sleep leads to fatigue. That leads to lack of motivation, which leads to increased muscle weakness, cognitive fog, amplified pain, mood drop, and then guess what? Insomnia. They can't sleep. Many health professionals will also dismiss some of these symptoms and fail to manage them, as they have little insight into the complexity of a person with MS. It may well be that the person who cares for them that can advocate and open the door to help. So as a carer of a person with MS, it's worth having an understanding of all symptoms that might present and why they actually occur. Symptom management. So noticing and mentioning the symptoms, observing the impact, what's MS, what's not. Here is where we start to see the role for family and friends. So you might actually notice a symptom that the individual hasn't realised is a symptom of MS. So it might come on gradually, and perhaps the individual is just putting up with it, or they are aware they may have a new symptom and denying its existence or not wanting to worry you about it. There might be a role for you to gently say something like, you've noticed and you wonder if there's something that can be done about it. In MS, most of the symptoms can be managed, and unless the neurologist or the GP knows about the symptoms, they actually go untreated and unmanaged. And as we've already said, many of the symptoms are invisible but can have this massive impact on life. For example, going out becomes difficult if bladder urgency is a problem. Previous love family activities such as camping or bushwalking become troublesome if the person's currently worried about their balance. Car and boat shows, quilt shows, or festivals become harder to manage when fatigue's a problem. The individual might be inclined to avoid these activities when there are ways of managing them and pursuing the interest. Helping the individual to figure out what is MS and what's not can require some gentle guidance statements like, let's ask about that, or write it on your list of questions. These sort of things can be really, really helpful. And after a diagnosis of MS, routine health issues must still be followed up. It's not always MS. So I will often say to people who call in, let's check with the GP first. Let's make sure that your dizziness, for example, isn't an ear infection or a change in your blood pressure. So it is really important that we remember routine healthcare. So at this point, it might be time to clarify the difference between a relapse and pseudo-relapse. Now, you've probably all heard about people with MS talking about a relapse or an attack. So when we talk about a relapse, we talk about a relatively sudden episode evolving over 1 to 7 days, or either new or worsening or existing symptoms that last longer than 24 hours and have been 30 days since the previous attack and not related to other triggers. Whereas a pseudo-relapse is a temporary symptom flare-up that has nothing to do with the course of the disease, but happens because of a trigger, so like fever, stress, heat, or exercise. Sometimes there are triggers that can bring about an exacerbation of symptoms that an individual may not realise can be reversed with removing a trigger. So for example, walking on a hot day might increase fatigue and muscle weakness. But if that person has cold water to drink or ice and rests in air conditioning, you can cool the core body temperature down and recover. So you may notice certain activities causing an exacerbation of symptoms or frequent urinary tracts. And again, urinary tract infections, let's clarify that. And again, you may be able to gently approach the individual with your observations. Now, one of the things that we really like to encourage is the use of the preparing for your neurologist appointment information. And there's a fact sheet on our website, and it includes things that you can sort of just write down basically: my appointment date and time, new symptoms that might be caused by MS, old symptoms that have come back or worse, any tests to discuss, major life changes to share, and medication questions. Sometimes it's really good just to jot it all down and have it ready. Red flags. What is a red flag? Okay, and what we mean by a red flag in this case, we're referring to a signal that a particular problem needs attention. So understanding common symptoms of MS and how they may impact an individual can often help you identify red flags. Remember, knowledge is power. So one of the things that can be noticed is depression. So you might see a loss of appetite, binge eating, social withdrawal, increased substance use, lack of enjoyment, irritability, but unhappiness, negative talk, worthlessness, like it's all my fault, life's not worth living, you're better off without me, increased fatigue, nausea, insomnia, headache, muscle pains. So what do? Gentle approach the individual. I have noticed. Can we talk about what's going on for you at the moment? If you felt urgent system was required because you felt that they were at risk, you can call psych triage. Emergency departments at the hospitals or 000. And there's also assistance. You can just speak to the GP and helplines, or just reach out to a health professional to discuss some of those things that you've picked up that you have concerns about, and whether, and get that advice and where you should go from there. Insomnia, poor sleep's a precursor to amplified symptoms, as we've mentioned earlier. Address this with the GP. So why aren't they sleeping? Are they depressed? Do they have increased pain? Are they worried about their disease? What's actually going on for that person? Let's get that sleep addressed. The impacts on day-to-day life. So poor lifestyle choices, acopia is a good word, which just generally means that they're not coping. Maybe you've noticed some poor personal care, some disruptive routine, or activities that they've enjoyed in the past and suddenly they've stopped doing it. Some people can become hyper-focused and obsessive. So They may be enforcing a specific order for events or objects. They might be following a very strict routine or forcing someone else to follow a strict routine, or they might be demanding reassurance constantly, especially for one perceived flaw. If you notice a significant change in behaviour, you might know some ongoing denial, so refusing help, being disengaged, refusing to see the doctor, non-compliance with medications, certain risks, falls are increasing, personal hygiene's dropping. Maybe there isn't a really good availability of food, particularly if they're living on their own. You might notice some side effects of medication changes, which is consistent with starting a new medication. So red flags require a very careful approach, respectful approach, and may require professional advice to ensure appropriate help is acquired. Your role. Am I a carer? Good question. Yes, you are. You are a carer. Whether you are a friend, a family member, a partner, you are a carer. The definition of a carer are people who provide unpaid care and support to a family member and friend who have a disability, a mental illness, chronic condition, terminal illness, substance user, or who are frail aged. It can be physical or emotional support. And obviously, some carers have a heavier burden than others. Nevertheless, it is still a role of caring. And interestingly, according to the Care of Australia statistics, there are over 2.65 million registered carers, and that makes up nearly 11% of Australia's population. And yes, you are one of them. Caring can be emotionally and physically exhausting. And carer burnout is a real phenomenon. So you may have heard the term carer burnout. So I'd like to talk a little bit about it. So burnout's the state of feeling emotionally and physically exhausted as a result of being exposed to excessive and prolonged periods of stress. So when we're exposed to these periods, it's common to feel overwhelmed by the amount of caring undertaken or to feel undervalued or unappreciated. If these feelings are present, then you may be at risk of developing burnout. So you might have physical exhaustion where you're feeling tired most of the time, and you may even feel as though you're not able to complete the task to the same standard you once did. You might have changes in appetite or sleeping patterns. You might have frequent headaches and tension. You might have lowered immunity and resulting in frequent sickness. You might have lost motivation. You might be feeling helpless. You might have increased cynicism and negative view of the current situation. You might have decreased satisfaction or sense of accomplishment. You might be feeling a sense of guilt or shame or doubting your skills and ability to assist the person that you actually care for. You might have some social withdrawal, procrastination, or you might be using alcohol or drugs to cope. The important message here is to recognise if you are reaching this and to do something about it before it affects relationships. Your own support, it's important to acknowledge your role and accept time out, assistance, emotional and physical support. Everyone's battery has a limited life and needs to recharge to keep running. And there are many carer support groups within your state. Focus on the strengths, encourage the person with MS to embrace healthy lifestyle practices, looking at good brain health options, keeping active physically and keeping the mind active, keeping weight under control, avoid smoking, limiting alcohol. Encourage activities of enjoyment, either alone or as a pair or a couple. Encouraging skills and adapting ways to continue these activities. You know, like for example, if they really like cooking, get the appropriate cookware and knives and things like that to enable that to happen. Remain respectful to the individual and consider their personal beliefs, their spirituality, choices and relationships. Humour, learn to laugh at the situation, embrace moments of joy. Never lose sight that the individual is the same person but needs to make some compensations along the way to fulfill a happy, normal life. accept that there will be some bumps along the road and be ready for them, armed with knowledge. And what do you do when you hit those bumps? So we've talked about some of the things that you might notice and perhaps some gentle ways of bringing those up with the person that you know with MS. And if in doubt, you can go to different places for support and advice. Now, we have numerous places, and obviously some are more relevant than others depending on what the situation is. But initially, you can go to the GP, you can go to the MS nurses, you can go to the MS clinics, you can talk to the neurologists. You can always call MS Connect and speak to one of us as well. NDIS is really big at the moment, so if you're under 65, it is really worth exploring NDIS for supports at home. TPD, it might be that the person that is still working and maybe it is time to consider TPD, which is with your employment. So you can get some legal advice around that. We have an employment support service that you can access, and all the links for this and the information can be taken off our website. Chronic disease management plans are a really good way of accessing allied health like occupational therapy, speech therapy, physiotherapy. If you don't have these plans in place, it allows you I think around 6 sessions or so with one of the allied health members. You get these through your GP, and often that's enough to get a plan in place, to get an assessment done. So please keep that in mind, as are mental health plans, to see a psychologist of your choice. And often when I'm directing people for mental health plans, I'm reinforcing that it's not because we think they're crazy or they've got some significant mental health issues, but when we're dealing with a chronic disease that's not going away, often there's a lot of grief and loss involved. And a really good psychologist should be able to give some terrific strategies about how to managing some of these feelings. There are carers payments and allowances through Centrelink. There are many carers support services. BrainLink in Victoria is an absolute winner if you're a Victorian. Carers Victoria, Tasmania, New South Wales, ACT. The Commonwealth and Carer Respite Centre is another really good one. If you're over 65, look into the My Aged Care and put an application in. Some practical suggestions. Disability parking can make a huge difference when you're with someone. And if the person that you have MS has a disabled parking spot, you can take them out if you're a friend and you can park in that spot as long as you've got their parking sticker, so it opens up your options for going places. A companion card is a brilliant thing to apply for. It's a national card that if the person that you are caring for is unable to access venues on their own. So let's just say they want to go to the State Theatre to see, I don't know, a famous singer of some sort. You can they pay for themselves and you get in free with their companion card because you are their companion. It's really worth looking into. There are a lot of electricity rebates and utility concessions that I think a lot of people are unaware of, like the cooling concessions, for example, over the summer months. Peer support groups, plenty of those around and lots of information on our website. There's a lot of online mental health support. So you've got all those free lines like Lifeline, Grief Line, Psych Triage. And remember, it's not just for the person with MS. So if you're caring for someone and you can see that you're having some relationship issues or you have great concerns about their safety, please use these helplines. Another really good one that's a free service is the National Continence Helpline. So if the person that you know is struggling with some continence issues and you want some one-on-one phone time with them, they're open from 8 to 8 and they are a fabulous resource. So you can get that number off the internet as well. So that's it from me at the moment. I hope that that has sort of opened up your mind a little bit to how to live alongside someone with MS. And as I said at the beginning, everyone has a different experience, but if you do need to speak further, we can talk one-on-one as long as you would like to. And you can reach myself and my colleague Jane through MS Connect. So with that, I'm going to hand back to Andrea, who's going to go and talk about some more of our support service slides. So thank you, Andrea.
Thank you so much, Bridie. That's been fabulous to just, and I'm sure everybody had their pen and paper jotting down different things throughout your presentation, whether it was the practical aspects or whether it was thinking through the sort of the more subtle changes that MS causes in relationships. And as Bridie said, it might have raised questions for you that you would actually prefer to take offline. You're very welcome to pop in some questions now and we can have some question time in a couple of slides. But it might be something that you're thinking, no, actually, I really need to talk to someone one-on-one about my situation. MS Connect is the starting point, and that applies whether it's related to today's topic or any topic to do with MS. The team there are ready to take your call, and if you have to leave a message, please do, and let them know when you'd like a call back, because they can call you back at a time that suits you. But MS Connect is a fabulous starting point. Peer support is also worth mentioning. The peer support team on the screen there, you've got Kat and Kim and Ange, and they can arrange one-on-one phone support with a trained peer. So whether that's a person living with MS talking to another person living with MS, or whether it's a family member talking to a family member. We have a whole lot of trained peers that are able to do one-on-one phone support, but also who lead groups. So a lot of those groups are meeting by phone or meeting online, and some are still meeting face-to-face depending where they are, but they can be a fabulous resource for people just to share ideas, to bounce experiences off, and to get that support from someone else who's also living the same situation. So please make use of that program as well. Again, you make that connection through the MS Connect team. We are a registered provider within the NDIS space, so we can give people lots of support around accessing that support and those plans and that funding. So again, please don't be backward in coming forward asking for some help. And similarly, if you're navigating my aged care, if the person living with MS is over 65 and you need some advice around that. So we would love you to pop in any comments or any questions that you feel we can handle today, but equally you might be thinking, actually, what I really want to do is talk to Bridie one-on-one, and that's okay too. You can call MS Connect and set that up. Let's have a look what we've got over in our question area. So the numbers there for MS Connect, the 1800 042 138 is the best number for calling MS Connect or sending an email. That's cool. And a little conversation that I've been having during the program is that whole situation where, particularly in lockdown that we're experiencing in Victoria, you might not be seeing the person that you're supporting who's living with MS. You might be, in that more remote situation at the moment. And that can be really hard to figure out what support they're needing because you're not actually seeing the subtleties. So that really does require them to speak up, but maybe it also requires a few kind of well-worded questions on how things are going, and that reminder that people can share with you. It's lovely. This is the second part of a kind of a two-part webinar series of thinking about the role when you're supporting someone. The other one that we ran that's on the website was more pitched at people who are newly diagnosed, but a point that we made in that one too was really encouraging that people have different relationships with different people, and so they might come to you with one particular concern, but they might go to someone else with a different concern. So I guess it's always good to just be aware that they might not come to you with everything, and that could be shared. Thank you. All right, there's no other questions or comments coming in. So we're either going to be an influx of phone calls, Bridie, or we've covered off everything that people want to know. So again, thank you so much, Bridie, for your time today, and thank you everyone for being online with us. We're a broken record, but please reach out anytime you need help or support, or you've got a question. There's no such thing as a silly question. Just ring MS Connect and they will direct you to the right person to answer your question. So thanks everyone. Thanks for being online, and thanks Bridie for your time today.
Bye everyone.